Welcome to the Community Outreach Lab Introduction to Fruits and Vegetables through the Department of Health and Human Physiology at the University of Iowa. The content displayed on this website is aimed at improving an individual's habitual fruit and vegetable intake. This is important as it reduces the risk for chronic disease. According to the 2020 to 2025 Dietary Guidelines for Americans, individuals should increase their fruit and vegetable intake to reduce their risk for diet-related chronic diseases, such as cardiovascular disease, type 2 diabetes, some cancers, and obesity.
As you increase your fruit and vegetable intake, it will support your overall bodily function by deviating away from certain health diseases and disorders. By including more fruits and vegetables to your daily meal, you are able to benefit from improved quality of sleep, improved daily mood and focus, increased energy metabolism, increased dietary fiber, and of course, reduced risk of future chronic disease.
According to the Dietary Guidelines, at least 80% of Americans do not meet the fruit consumption intake. On top of that, about 90% of Americans don't meet the vegetable intake. This opens the topic of nutrient deficiency. Nutrient deficiency is a state where the individual is not able to work at their optimal health due to insufficient nutrients, such as vitamins or minerals. Nutrient deficiency can cause symptoms from weight loss to general fatigue and irritability. If you continue to have concerns regarding your individual nutrient assessment, please consider contacting your doctor to discuss dietary habits.
Americans eat on average 3,400 milligrams per sodium per day. However, the Dietary Guidelines for Americans recommends adults limit their sodium intake to less than 2,300 milligrams per day. That's equal to about 1 teaspoon or 4.2 grams of table salt. Eating too much sodium can lead to chronic issues like increased blood pressure. Individuals who are at a high risk of developing high blood pressure should follow the nutritional guidelines. The guidelines for fruit and vegetables state that the average adult should be eating 2 cups of fruit and 3 cups of vegetables in their daily intake. Increase your fruit and vegetable intake allows for sodium levels to decrease within the body.
The Dietary Guideline for Americans also recommends limiting calories from added sugars to no more than 10% each day. That's 200 calories or about 12 teaspoons for a 2,000 calorie diet. For individuals who are trying to increase their fruit and vegetable intake, it is important to be educated on measuring salts and calories. Being able to measure your amount of salt or sugar intake significantly lowers susceptibility to heart disease or chronic disease. Over time, adding too much sugar can lead to greater accumulation of fat, which may turn into fatty liver disease, while also being a contributor to diabetes. In addition, consuming too much added sugar can raise blood pressure and increase chronic inflammation, therefore increasing the chances of being diagnosed with pathological pathways such as heart disease. With the topic of sugar, there needs to be an understanding of artificial sugar versus natural sugar. Artificial sugar is sugar that is chemically modified in the lab, while natural sugar is sugar found in fruits and vegetables. While both are still sugar, we still need to limit the amount of sugar to no more than 10% according to the Dietary Guidelines to help prevent chronic disease.
Some strategies to increase your fruit and vegetable intake can be cutting up or preparing fruits and vegetables on the weekend before each week to reduce the preparation time it takes during the week. It can also help keep fruit and vegetables readily accessible in your fridge or pantry, which allows you to trade highly processed prepackaged snacks for a much healthier option such as sliced apples. Preparing food at home can even prevent extra expenses like stopping at a fast food restaurant. All these strategies allow individuals to increase their daily dose of fruit and vegetable intake.
All fruit, including fresh, frozen, canned, and dried, count as daily intake. In order to improve your fruit and vegetable intake, it can be as simple as adding a cup of fruit or a cup of vegetables to at least one meal a day. Other specific examples can be to adopt a new rule of thumb to always top pancakes, cereal, or oatmeal with fresh fruit. Or you can try to incorporate mindful eating at every meal, which allows methods like PASS to assist you with mindful eating.
PASS. PASS is an acronym which stands for Ponder, Appraise, Show, Savor, Stop, and Save. Ponder. Check in with yourself about your hunger before you eat. You may actually be thirsty, bored, or stressed. Instead, have coops readily accessible in your fridge for when you might become hungry. Appraise. Take a moment. How did the fruit smell? Slow. Slow down so your brain can keep up with your stomach. Put the fork down between bites and focus on eating warm vegetables first. Savor. Enjoy your food, the taste, the texture, everything. Take a moment to savor the satisfaction of eating fruits and vegetables before savoring the protein part of your meal. Stop. Stop when you're full. There's no need to join the Clean Plate Club if it means overeating. Save. Save your fruit and vegetables by keeping them frozen or cut up in an airtight bag seal or Tupperware. Alternatively, avoid moisture to prevent mold and waste. Try any of these tactics to help you improve mindful eating.
On our website, we highlight many methods to integrate how to increase an individual's fruit and vegetable intake. However, not everyone has access to fruits and vegetables. Areas that are considered food deserts or food swamps do not allow people to reach the nutritional guidelines due to their environment being saturated with unhealthy foods or lack of healthy options. If you find yourself not being able to afford certain fruits or have a hard time getting into areas that have vegetables readily accessible, we recommend applying for SNAP. SNAP, also formerly known as the Food Stamp Program, is the nation's most important anti-hunger program. SNAP provides nutrition benefits to supplement the food budget of families. For more information about SNAP, visit the website, which will be provided below.
It should be known that the following modules are focused on basic information on how to increase fruits and vegetables. This content is not intended to build accredited registered dietitians, but rather more informed individuals. We hope you have found this video useful, and we hope you have gained new knowledge to improve your fruit and vegetable intake. Thank you.